Good day. I'm Luba Andrus. I'm a pharmacist. I'm on the board of Equilibria. I've been a pharmacist for over 40 years. I've owned a pharmacy. I've worked in long-term care. I was director in a hospital. I am now very much influenced and excited about working with cannabis. I've owned 2 dispensaries. Healing with cannabis is our discussion today. Cannabis is a flowering plant. It's one of the safest and most versatile herbal medicines on the planet. According to Dr. Raphael Mechoulam, the father of cannabis science, an organic chemist and professor of medical chemistry. Of course, he would be one of my favorites. Cannabis is one of the most pharmacologically active plants on the planet, with over 400 different chemical compounds. Cannabis works well in most individuals. We mentioned that before. It works in insomnia, depression, balance of life, pelvic inflammatory diseases, endometriosis, menstrual pain, menopause. Can you believe? We have to go back to look at the endocannabinoid system that was discovered in 1992. I was already a pharmacist for 20 years when I found out about the endocannabinoid system. Endocannabinoid system is one of the regulatory systems in our body. It's everywhere, from the brain to our toes. It is everywhere. It controls everything from relaxation, eating, sleeping, inflammation, and even cognitive function. In a nutshell, your ECS system is responsible for making sure your entire body is working optimally, and mine too. And I think I have a pretty good endocannabinoid system. So what are these endocannabinoids? Well, they're naturally occurring molecules. As a pharmacist, I love molecules. Produced in the body that stimulates receptors. Who knew I had all of these receptors that are so cool and working on my side? Found in the brain, in organs, my tissues, glands, and in the immune cells. Some of the active pharmacological components of the cannabis plant mimic what we have in our body. So you have this plant and it attaches to what we already have in our body as the endocannabinoids. Very interesting research that I've read about, and I just really, how I figure all of this out in my pharmaceutical brain, is that's the CB1 and CB2. These are the 2 major receptors that we talk about. There are many more, and there's more being discovered all the time. So once you start studying endocannabinoid system, start studying cannabis, it's so exciting. I'm just going to get overwhelmed here. It is so exciting. There's so much to learn. There's so much out there for us. And now we start taking responsibility over our own lives. So we've got the CB1 and CB2. Sounds like a car dealership. CB1 receptors are located in the nerve cells of the brain, spinal cord, in the peripheral organs, and the tissues. These receptors they're associated with appetite, movement, posture, sensory perception, memory, cognition, and emotion. In 1992, CB2 receptors were discovered. They're primarily located in the white blood cells and outer tissues of the immune system. They're associated with inflammation and pain. So here we are, CB1 and CB2. Learn that, know that, you'll know exactly where you're going. We talked about CB1 and CB2 and how the cannabinoid systems interact and they attach themselves to the endocannabinoid system, to these receptors. What they do is they like a key to a lock, they lock it in. Like the oil to the Tin Man, they grease it up. It works in that specific area. If you can't sleep, they will help you sleep. Depending on the product you're taking, how much you're taking. We'll talk about that in just a few minutes, about dosing and products and the different products that are available. It's very complicated. I need a blackboard and to show you all this stuff, so we're not going to discuss that now. But I'll give you homework. Do look for the endocannabinoid system, also known as ECS. Read about it. You won't put that book down. Let's talk about some hemp versus marijuana, another question that's always asked. Well, hemp and medical cannabis are in the same genus. What does that mean? Well, hemp plants contain no more than 0.3% of THC, the psychoactive tetrahydrocannabinol, the psychoactive component. Marijuana plants, again, they can have 5 to 30% of THC. Plants with 0.3 are hemp. Plants with more than 0.3 are marijuana. CBD has exploded in popularity recently because of its benefits. We see it everywhere. We see it in grocery stores. We see ladies in church talking about it. We hear mothers at the bus station talking about it. We're following everyone that's CBD. It seems to be used for everything. So CBD is a 5,000-year-old botanical superstar. That's what we have in our hands. Here it is. Take a look at it. Understand it. Understand it. That's what's most important. Understand yourself. It's completely safe and non-addictive. Pharmaceutical companies can't patent CBD unless they turn it into a synthetic chemical first. We have a natural product here. So now you know hemp, you know marijuana, you know CBD, and you're going to go buy a product. Make sure it's organically grown, no GMO, soy-free, gluten-free, sugar-free. No additives, emulsifiers. Get that certificate of analysis. The product that you have, you want to make sure you know the laboratory that tested your products and you have a very positive result. It has to be free of metals, no lead, free of toxins, no pesticides, no herbicides, no insecticides, free of molds and fungus. Just meet all the basic quality and safety standards. So important in getting the right product so that you are not getting sick from them, you are not vomiting, you are not getting any bad side effects. Very important to get the proper product. Don't look at price. Price is not always the thing, but always make sure it has a laboratory and look for good products. Especially these days, you've got CBD coming up everywhere, including your favorite gas station. Let's talk about methods of administration. We know that there's many ways you could take the product. Here we have our oil, we have our topical, and we have our capsule. Excitingly enough, we're soon coming out with a vaginal suppository. As a pharmacist, I am looking forward to see this product. It should be very soon. It's still within our laboratories, but keep with us, it's coming. So the oils or the tinctures, the onset could be anywhere between 15 to 40 minutes, and it could last in your body for 45 minutes to 2 hours. I like these, I like them for morning use. You could start with a little bit. What I like about this, you could titrate it. You could have or microdose it. You take a little bit throughout the day, but always know what you need, know what your goal is, know why you're taking it, when you're taking it, to be safe. The capsules, I prefer taking the capsule at night. It helps me sleep. It helps me relax. Again, it can be taken during the day. Everybody is different. I could take it at night and I'm asleep within an hour. You could take it at night and you may be awake for the next 3 hours. So maybe you'd rather take it during the day. It's all, once you start these products, please remember, keep a log. Keep a log on what you're doing, how you're doing this, how long it's lasting, and what you ate that day, how was that day. You may not need a log, so please, but remember, as a pharmacist, again, I'm giving you advice. The advice is, these are medications. When you start the capsule, it's every day. We'll talk a little bit about metabolism, safety, addiction, overdose. Again, questions I get all the time. Well, as mentioned earlier, cannabinoids are a diverse set of chemical compounds that make up the endocannabinoid system. Right? Low risk for addiction or abuse. There has never been a death recorded. Overdose, okay, that's something different. Overdose is abuse. It's overindulgence in a product. That can cause paranoia, vomiting, nausea, headache, or like my lady that slept 14 hours. That's not an overdose, but she slept for 14 hours. Marijuana use can lead to a development-caused marijuana use disorder, and that, again, that's associated with dependence, and the person can feel withdrawals when they stop it. Let's talk about drug interactions. Very important, because there are drug interactions. So we need to identify these interactions: cannabis and prescription medications, cannabis and OTC medications, cannabis and food. I know sometimes we can't, well, of course, I would never recommend cannabis and alcohol, so that's a big no-no for me. We have pharmacists' expertise that are right here with Equilibria. We'll look at your drug interactions, and we'll make sure that you're taking a safe product at a safe dose at the right time. Meeting patients' needs through education. This is what we all do here at Equilibria, offering guidance to the patients, offering guidance to physicians. Let's say your physician wants to speak to a pharmacist. Well, here we are. Pharmacists are here. We'll be more than happy to take any clinical advice to our practicing physicians. The responsibility of all of us is to provide, prepare, and to challenge. We're providing an overview. Here in Equilibria, we're doing an overview of cannabis. We're preparing you to take the right product. Our dosage specialist wants you to take the right product at the right time, making sure that you're comfortable with the delivery system. And it's a challenge. It's a challenge for us, and it's a challenge for you, and it's a challenge for your physicians. So make certain, once you start, you do let your physician know, especially if you're taking multiple medications. You must let your physician know, because there may be an adjustment needed on your other medications. Well, we're coming to the end of this session. So we all know the story of CBD oil. Yes? Yes. What is cannabidiol? What is the endocannabinoid system? The healing compounds in CBD. Important facts we've discovered: the difference between hemp oil and CBD oil, powerful health benefits of cannabidiol, how to choose a high quality product, and drug interactions. So cannabis can treat inflammation, improve mood, help fight depression, lessen prescription dependency, and reduce polypharmacy. Well, attitudes are changing. Are you ready?